Ebola not only led to upgraded medical facilities, it also spurred medical innovation. For more on that, I spoke with Kate Tulenko. She's the Vice President of Health Systems, Innovation, and IntraHealth International. I began by asking her to explain the mobile applications conceived from the Ebola crisis and how they are being used not just in epidemics, but in modern healthcare as well.
Yeah, unfortunately, it takes tragedies like AIDS or Ebola to force people to invest in needed innovations. Certainly, a lot of technology did come out of the Ebola epidemic. We certainly wouldn't have had the Ebola vaccine, but also payment of health workers via mobile phone is now new. Getting governments to work with the private sector. In fact, interestingly, towards the end of the epidemic, the majority of health worker infections were occurring in private sector workers, and the government didn't really even have a list of these workers. And so being able to communicate with them via their cell phones, make sure they had protective equipment and the proper training.
Who should pay for healthcare innovation? We all agree it's very important and it can reach untouched and unprovided for populations. But what's your take on who should pay? Should it be governments, private companies, nonprofits, or some combination?
All three have a role in paying for healthcare innovation. Governments have a role in paying for innovation to reduce inequalities, to reach out to underserved communities or marginalized communities, and also to address orphan diseases or diseases for which there's not a real market. The private sector really can focus on innovations for diseases where there's a huge market so they can recoup their costs. Then the nonprofit sector in some ways are best focused on where there's kind of a controversy or there's social issues. For example, during the beginning of the HIV/AIDS epidemic, it was really only the nonprofits who could kind of make inroads because they could kind of get rid of that criticism, whereas the governments were reluctant to intervene. I think governments also have an important role in financing the scaling up of innovations and in moving them from innovation to best practice.
So what does that look like, the scaling up? Is there an example of a country that's been through all of these? Let's say maybe in the HIV/AIDS case where you've had the NGOs and the nonprofits begin the process, but then there was a market for it, and then you've got governments now playing a role. Talk us through what that looks like.
Sure, that might be for a drug, say AZT. So say a drug had been tested in just a few communities. We need to show that it works in communities where there's very poor nutrition or where people don't have watches and they can't take it at the exact same time every day. And so the government can often provide the larger amounts of funding to make the access to the drug or the innovation more wide.
You mentioned where people don't have watches. So when you're innovating, you have to think about, just at a baseline, what does the average patient have and what can I even rely on?
Yes.
So if that's the problem, how has technology been the solution in areas where people literally have nothing?
Yeah. I mean, really one of the greatest revelations in health in the past 10 years has been the mobile phone. I call it the new stethoscope. Mobile phones are the technology that has permeated the world faster than any other technology, faster than electricity, faster than radios, faster than cars. And with mobile phones, you can practically do anything in health. And for example, in the developing world, they really have the treatments they need for the majority of the diseases. The challenge is getting it out to the people in the most remote communities or the poorest communities. And information and communications technology, or ICT, and mobile phones can help do that. In fact, my organization, IntraHealth, has a free application. It's an electronic medical record that can be used by community health workers to really improve the quality of their care and give better care to remote communities.
And is that something, when you talk about electronic medical records, I think a lot of countries are trying to get there. Is that something where your phone would literally store everything a doctor needs about your health history?
Yes. Yes, the Android smartphones are getting to where they're about $40 per phone, so really almost the same price as the Nokia phones. And these phones are very powerful. And a lot of these electronic medical records, they now can store the data. So even if the health worker is out of the range of cell phone signal, the data can be stored until the phone is within range and then uploaded.
The technology exists, is what you're saying. Is it out there? Is it available?
So often, actually, with that, it's about scope of practice. So, traditionally, we've had physicians perform and read sonograms. So what does it mean legally if you're having an illiterate woman with 6 months of training actually performing the sonogram, but a physician is reading it? So often the government can really be proactive and make it clear that that is legal and that is within the scope of practice for her to do.
A lot of people have cell phones. There's a high level of penetration in the developed world. What's the cutting edge of this type of thinking? What's the next big thing in technology applications in health?
Well, the developed world has two challenges. One is our sort of new disease profile, dementia and cancer. And a lot of those innovations are around genetic innovations and genetic treatments. But the other challenge is the aging of the global north, and how are we going to be able to take care of a large number of seniors living in their homes. So some of this is remote monitoring of vital signs, blood sugar. Has grandpa gotten up today? Has he taken his medication?
But how are you going to get older people who are not necessarily technology savvy to do something like that? I mean, my grandmother has a cell phone. She doesn't like to use it.
It doesn't have to be structured as a cell phone. There's a teddy bear that if you hug it, it can take your temperature, your heart rate, your pulse.
But that relies on mobile technology?
Yes, it does, yes. So it doesn't have to look like a phone.
Oh, really? So you don't even need to be able to use it to make a call?
Exactly, right. And some of these monitoring devices, they're based on pressure pads, so they can see whether someone has literally gotten up and moved around, or also, bracelets and necklaces that people wear.
So is this going to augment or replace things like hospice care, in-home nursing?
I think it's going to augment. People are still going to need those services, but this will make it more cost effective and also be able to allow people to have the services sooner within their health course.